Why do you want to have this discussion openly? And honestly, when you're joining, the question would be, why would I concern myself with this? It looks like it's a female issue. It looks like it's a mother issue, so you don't have anything to do with it. But we've seen that the setup of where the woman kind of leaves the hospital setup, postnatal setup, there's so many things that play into making sure that the woman kind of has a quick recovery. And we've seen there are a lot of stakeholders during that whole process. So then the neighbor comes in, the spouse comes in, the family setup comes in, society comes in. So everybody's involved one way or another. Now, maternal mental health is essential, but often overlooked, because part of maternal, newborn, and child health, it's something that has all been gulfed into one umbrella, but the mental health aspect of it hasn't been discussed for long. So during pregnancies and the first year after childbirth, women may experience depression, anxiety, trauma, you name it. There's some mood swings and changes that at times you feel like you cannot explain it. But we're hoping that during this discussion, you kind of get tips and also kind of try to identify when these things are happening. Now, the World Health Organization indicates that about 1 in 5 women experience a mental health condition during the perinatal period. So we're looking at maybe things like depression, you being down, etc. The risk is shaped not only by clinical factors, but also some other factors come into play. So it could be the setup, the family setup, poverty. We also have the issue of gender-based violence or intimate partner violence, limited social support, especially when we're talking about adolescent pregnancy. This is an adolescent who's getting into motherhood, and it's a whole new terrain for them to handle. So that's why we're having this discussion, and we're hoping that therefore focus on early identification, respectful care, referral pathways, family support, community support will be things that will come into play. And, that particular support will also help kind of make the whole process of childbirth, on being a mom, much more, enjoyable the way it's supposed to be. So we're hoping, but by the end of this discussion, we'll take an hour, 30 minutes. I'll do less talking, I promise, because we have experts who actually understand this discussion altogether. So we're bringing the experts in terms of the medical side, experts in terms of community. We actually have mothers on the call. So we're bringing that lived experience. And of course, this is not only a female discussion. We also do have Brian, who's going to bring in that male perspective and his expertise. And we're expecting that, by the time we're done with this conversation, you'll have learned something, and maybe we might have learned something from you in return.